Thank you, Mr. Chair. I want to start, first I want to thank you all for being here and appreciate how busy you are and taking the time out to come and answer our questions. You do add real value and perspective. Dr. Trish, the Schaefer Center found that for every dollar Americans spend on insulin, less than half ultimately goes to the manufacturer. Instead, that money gets rerouted and taken by middlemen along the way, like PBMs. All the while, the list continues to grow. The list continues to go up, even on drugs like insulin that have been around for more than 100 years. I think that's really at the heart of why we need transparency. Where is the money going? Why are we paying so much? So, Dr. Trish, you mentioned that transparency is a key, but further investigation is needed to truly understand how to reform the system and protect patients. What other areas do you believe need to be investigated?
So thank you for the question. I think one of the key other issues here is the extent to which this integration has changed the incentives. And I had the good fortune the other day of giving a talk at a health system where I had both the chief pharmacy officer and the HR person for the health system in the room. They were talking about this issue that we heard about, this report in Florida, but essentially because they're a health system, they own a specialty pharmacy, right? They dispense drugs to their patients. They were saying that their PBM for their beneficiaries is basically requiring them to use the in-house specialty pharmacy that's owned by the PBM, even though they can see that specialty pharmacy that's owned by the PBM is charging them more than 3 times more for the drugs than what they dispense in their specialty pharmacy themselves. And those are the types of things where that's harmful, that's not generating value. The extent to which that's also further affecting the types of rebate negotiations across drugs more broadly, that's what we need better insight into as well.
Right, well certainly in a lot of what you're describing we see throughout healthcare, which is the lack of mission. When I was a kid, and that's pretty long ago, doctors, nurses, pretty much everyone you met in a hospital or a medical center was there because they wanted to help bring reliable health care at the lowest possible cost to the people of their community, and somehow we've lost that. Dr. Pat, more often than not, consumers do not have the necessary information available to them about how much their drugs cost. Much less information about the role of PBMs, drug manufacturers, insurance companies, ad infinitum, that help each other raise prices. I think additional transparency clearly is important, but we must make sure that the information actually reaches the patients. So Dr. Pat, do you often find that your patients struggle to navigate the system? Does that come back to you? How can we make sure that PBMs provide the information in an accessible and easy to understand format without layering it under portals and portals and portals?
It's a great question. I'll say work closely with the Rocky Mountain Cancer Center doctors, so I'm grateful for your question. I think that we need to give more information to patients because frequently the cost of drugs prohibits patients from being compliant with care. I gave the example of the patient with imatinib that if they'd run it through their insurance, their copay would have been $1,500 per month, and whenever they didn't go through insurance, it was going to be just $150 a month at the practice. Well, if the doctor and the pharmacist didn't have an ability to have that discourse with the patient would have just not taken the medication and not benefited from the medication. We know from a study published in the Journal of Clinical Oncology in 2017 that patient adherence to their medication is directly related to their copay that they have to pay every month. And if it's cost prohibitive for patients, they are not going to be compliant. They ration their medication. Yeah. We've seen that time and time again. So that leads to ineffective care. So when you have pharmacists and medically integrated pharmacies where doctors talk to their patients, they're able to help navigate these complex systems, especially with expensive medications. So I think that interaction is really invaluable. And had that patient just simply been referred to a mail order pharmacy where they didn't get where they would have to pay to get their drug, they just would have not gotten their drug. So this interaction with the healthcare team becomes really critical so we can help patients navigate this complex environment.
Exactly, and I could not agree more. I mean, that's the additional hidden cost, is all those patients that end up not taking a prescription that would, alleviate their suffering or their discomfort, and in many cases, prevent them from getting well. So anyway, transparency's got to be at the root of all this stuff. Thank you. I yield back.
Thank you. Senator Warnock.
Thank you so very much, Senator Welch. Last week, I invited